Hi, my name is Emily. I'm the nurse practitioner who's going to be doing your abdominal and blood vessel assessment today. Can you please give me your full name and date of birth?
Zach Seach, December 23rd, 1993.
Okay, so we're going to start your assessment today with getting a routine set of vital signs. Okay, I got 122 over 78. Now we'll assess the patient's pulse, heart rate for 30 seconds. Okay, I got a 30, so that's heart rate of 60. And then we'll check respiration rate for 30 seconds. It's pretty normal. Okay, and I got 10, so heart rate or respiration rate of 20. Okay, so we'll just run over the growth and measurement and nutrition assessment. Have you recently lost or gained any weight?
No.
Are you on any medications or supplements for weight loss?
No.
And do you feel you get a good nutritional intake throughout the day?
Yes.
Okay, if you wanted to watch a little bit more of what you eat or try to lose weight, there's some tools we can educate you on. A 24-hour dietary recall, a daily diet, food diary, and also MyPlate to help you kind of make a plate that's more nutritious. So we can give you some information on that afterwards. So we will now check the patient's weight and height. I'll have them come over and stand on the scale here. Actually, I'll set it right in front of you. Okay, so about 176 pounds. And then we'll check the patient's height. Actually, can you turn? Patient is 5 foot 11 inches. Now we'll do a waist circumference. You can hold that there for 1 second. Okay. The waist is 33 inches. And we'll move down to hip circumference. And hip circumference is 39 inches. Okay. So that is it for our growth and measurement assessment on the adult. And I'm going to now have you lay down. We'll move on to our blood vessel assessment. I will note the color of the patient's skin on the abdomen and all of his extremities, noting that it's normal tone for ethnicity. Patient's texture of his skin is smooth. Hair distribution is appropriate. across the entire body. I will assess for any varicose veins, muscle atrophy, or nail changes. So let me see your nails. No nail changes, no varicose veins noted, no muscle atrophy noted. I'm going to assess the jugular vein for distension. So if you can turn your head to the left, good, and to the right. And I will note that there's no jugular vein distension. And I will measure from the point of pulsation to the sternal notch. And I will note that is approximately 3 centimeters, which is appropriate. Okay, so now we will move on to our palpation portion of the blood vessel assessment. We're going to palpate all of the pulses, starting at the carotid, palpating them separately. Move to the brachial pulses, radial pulses, the popliteal pulses, if you could just bend up a little bit. Post-tibial pulses, and pedal pulses. All pulses are present and a +2 quality. Now we will auscultate each of those pulses, first starting with the diaphragm of the stethoscope to note normal rate rhythm, and then I will move to the bell of the stethoscope to note any bruits. Again, starting at the carotid. Femoral. We'll note the aortic, renal, iliac, and femoral pulses on the abdomen. All pulses are present and +2. Now we'll move on to assessing for bruits. No bruits noted on auscultation at any pulse. I'm going to palpate the arms from the shoulders to the fingertips, noting any warmth or swelling, and none is noted. And I'll also do the same on the lower extremities. No warmth or swelling is noted. And at the ankles and feet, I will check for pitting edema. And None is noted. Also, I will note that the patient does have hair on his toes and feet. Okay. So that's all for our blood vessel assessment. Then we'll move on to our abdominal assessment. So we will inspect first on the abdominal assessment. I'm going to note the shape of the belly. Could you just put your arm to the side? Perfect. Note the shape of the belly is flat. It's symmetrical on both sides. There's no jaundice or abnormal coloring noted. No stretch marks or scars on the abdomen or abnormal pulsations. We did have the patient empty the bladder prior to the assessment. Also during inspection, I'm going to note the umbilicus. There's no redness, protrusions, bulging, discharge, or granulation noted at the umbilicus. Have you recently had any abdominal pain?
No.
Any nausea, vomiting, or diarrhea?
No.
Any constipation or incontinence?
No.
Have you had any pain or problems urinating?
No.
Or any increased frequency of urination? No. Okay. And then lastly, on inspection of the abdomen, I will note the abdominal landmarks, including the costal margin, the midline, the umbilicus. I'm going to note the xiphoid process, the anterior superior iliac spine, and the superior margin of the pubis. Okay, so we'll move on to auscultation of the abdomen. I'm going to auscultate each of the 4 quadrants in 2 spots for a maximum of 5 minutes. We'll start at the right lower quadrant and work our way around. Okay, vowel sounds are noted in all 4 quadrants, normal tone and frequency. And then I'll just auscultate over the anterior or the aortic. And no bruits noted there again. Okay. Okay, so now we'll start on percussion of the abdomen. I'm going to start percussion at the right lower quadrant. While in the right lower quadrant, I'll note any abnormalities of the right kidney. Moving to the right upper quadrant, here I will percuss the liver borders as well as the gallbladder. So note the upper liver border. Upper liver border and the lower liver border. And it's approximately 2.5 inches between those borders, which is appropriate. I'll move to the right upper quadrant. Here, percussing the spleen, and the right or the left lower quadrant for the left kidney, and the bladder, which is all normal percussion, tympani. Then we'll move to palpate. I will start with light palpation. During this time, I'll note for tenderness, and I'll ensure to assess the patient's facial expression to see if they're experiencing any pain during. So, starting with light palpation, 2 spots of each of the quadrants. Any pain or tenderness? No pain or tenderness noted on light palpation. And I'll also palpate around the umbilicus. Any pain there? No pain. Then we'll move to deep palpation. During deep palpation, we'll note any masses, hernias, or separation of muscles. No pain or tenderness. No pain or tenderness or masses noted. Okay, so now we'll move on to palpation of the liver. We'll do 3 different forms of palpation for this. First, I will start low and work my way up the abdomen, under the costal margin. Have the patient take a deep breath. And note that there's no liver enlargement there. Now I will place one hand under the patient's rib cage. Feel underneath the costal margin. Take a deep breath. Again, no liver enlargement noted there. Now we will assess with the hook technique. I'll hook both my hands underneath, have the patient take a deep breath. Again, no liver enlargement or tenderness noted. And also the gallbladder is non-palpable, which is appropriate. Next, we'll move on to palpation of the spleen. So first, I'll have the patient turn to a 45-degree angle. Place my right hand under their rib cage and my left at the costal margin, and have the patient take a deep breath. Good. No spleen enlargement noted there. Okay, you can lay flat. So that's all for laying. Now I'll have the patient sit. You can come sit here for me. Let's go ahead and sit on the edge. You can face the window actually. Okay. So now I'm going to palpate the kidneys. I'm going to use my fist to do so. Any tenderness?
No.
Okay. No tenderness noted on either the right or the left side of the kidneys. Okay, and then that's all for our abdominal assessment. Thank you.